This birth vlog that you're going to see later is really what I consider to be a real victory for me.
Another way to say this, but I think we were meant to be.
Well guys, this is part 3 of our birth vlog. It's our finale, so to speak, and we are going to just be doing a very quick Q&A, question and answer. We've got 10 questions here, some of which were submitted, some of which are just, you know, popular questions that everybody asks us anyway. So we're just going to do them in order and see how it goes.
So question number 1, how did COVID affect this pregnancy?
It really didn't.
It didn't. I made a big deal in the beginning in our first couple vlogs and first couple appointments, because I did go to the first appointment thinking that I'd be able to be there, and we were thrown off by that first appointment because A, I wasn't allowed to go in, and B, she thought she was going to get some scans. But what I, as a father, missed out on, but it's not, at the end of the day, it's not really a big deal. I missed out on being able to go in for those 2 to 3 ultrasound scans. That's what I missed out on. But other than that, life went on as normal. Even though I wasn't allowed to go, she still brought the photos home.
Yeah, life was fine. COVID didn't really affect us with this pregnancy at all. A lot of people are like, well, were you scared of catching COVID while you're pregnant? And, you know, all of that stuff. And I'm like, no. Did childbirth classes change you to COVID? What childbirth classes? We never took childbirth classes. Even with Serenity, like Serenity First Time Mom, we never took childbirth. I never did Lamaze classes is what they're called. I never did childbirth classes. And then this time around, I knew what to expect, so I'm like, childbirth classes, it's kind of pointless the second time around for me, at least. So we didn't really have to go down that route.
I would say what might have helped with childbirth classes is if we were here at the house and she did go into labor, it might help us with how to respond to those situations.
Because I've never actually gone into natural labor. I've been induced both times now. So that seems to be what my body prefers to do, as opposed to just going into labor naturally. But yeah, I can see that.
But that's where I think childbirth classes might help us out, is that we'd be able to know how to actually respond in the home as you got close to getting to labor, and knowing when to get to the hospital properly, because that one, we still don't know. We still don't know because we haven't lived it yet.
That scenario is unknown.
Question number 3.
Oh, how did I teach full-time without caffeine? It was incredibly difficult. And I was not as dedicated to being 0 caffeine with this pregnancy. The first pregnancy is all your first pregnancy. You're always like super careful, and you watch what you eat, and you eliminate caffeine and meds, and you get sleep, and you're watching how much you lift and things like that. And your second pregnancy, you're like, I don't care anymore. It's like, well, this kid's gonna turn out fine anyway. And they usually do. But I mean, teaching full-time without caffeine during a pandemic on a hybrid schedule was intense. Just because I didn't have caffeine does not mean I didn't do my Starbucks run. By the end of the year, I think I was up to 3 times a week doing a Starbucks run. And they were just getting me, like, for holidays and Mother's Day and Valentine's Day and things like that, they were just getting me gift cards for Starbucks at this point, and I was immensely happy. I was immensely happy with strawberry refreshers and green tea matcha frappuccinos. And then once a week, I allowed myself a cheat, and I kept change in my drawer, and I went to the vending machine in the staff lounge, and I would get either like a Diet Coke or like chocolate. I kept loads of chocolate in my desk. So how did I manage without caffeine? That's how I managed. I allowed myself to be more lenient this pregnancy than I did the first time around. But I think most mothers do.
Number 4, what was the difference about this pregnancy compared to the last one?
What was different about this pregnancy? Being pregnant with a toddler. Okay? Because with Serenity, it was just him and I. And I could come home, and if I didn't feel like cooking dinner, if I was just extremely tired, I could put my feet up on the couch, throw a movie in, and sleep the rest of the night. And that was perfectly acceptable. Now with a toddler, as any veteran parent will tell you, that is no longer an acceptable thing to do when you come home. Because Serenity demands your attention. She's 3. She demands attention. So I was on the floor, on my stomach, looking under the couch to try to find Legos, and I was 9 months pregnant, and I never would have done that with Serenity, when I was pregnant with Serenity. I would have said, well, the couch ate that thing, whatever it may be.
As a father, the difference for me was we knew what we were getting into when we went to the hospital and everything, and we had a lot of fun in the hospital for this pregnancy.
We did.
we blew
Bouncing
up
on aerobics balls.
We blew up Facebook a little bit. We used the aerobic balls to pass time up until the last 9 hours in, she had the baby.
Yeah.
So the first 4 hours we were having a lot of fun, and by 11 o'clock, so 6 hours in, is when she finally hit the bed, and she had to stay there because she was getting the epidural, and we were moving into having labor and everything. But it was a lot of fun this pregnancy.
It was, actually. I kind of enjoyed being in the hospital this time around. Last time around, not so much.
And if you watch our birth video number 2, part 2, she explains a lot more of the difference between the 2 pregnancies.
Yeah.
So check that video out. Moving on to question number 5. Did I have a birth plan going in? Did I stick to it?
So when people say birth plan, they often say, oh, that often gets associated with pain management. And I will just say that I wanted to go as long as possible without getting an epidural, but I knew when the time came around, I was going to need an epidural. Because there's no way. Kudos to the moms out there that can push out a baby without pain relief. So, pain management, I wanted to go as long as possible without getting an epidural. And I didn't really want to have any of the, IV pain meds that they can give you, okay? Because I had horrible experiences with that during the first pregnancy, because that's what made me just sleep most of the time, and when I wasn't sleeping, I was shaking so badly. I really wanted to avoid Pitocin, which they give you, and which I believe I did avoid it in its entirety. I have no idea how I did that, but I avoided Pitocin. Because I induced labor, I didn't have the Cervidil this time, which is where it stays in you for 12 hours. I had the Cytoflex or something like that, which stays in you for about 4 hours to get labor started. So it was really 4 hours with the Cytoflex to get labor started, and then an additional 2 hours or so with no pain relief, no drugs, no nothing. And by that point, I was at 3 to 4 centimeters. And my pain level was at a 6 out of 10, and that's when I asked for the epidural. And after the epidural, everything went very quickly, as he was born at 3:30 in the afternoon. So for the most part, I stuck to that birth plan, if you want to call it a birth plan, and I got what I wanted. I really wanted to stay away from Pitocin. I wanted to stay away from the IV drugs. I wanted to go as long as I could without needing the epidural, even though I knew I was going to need one in the end. And I think I did pretty well. I stuck to that pretty good. I also really wanted skin-to-skin time with Ollie afterwards, because I didn't get that with Serenity. And I got that with him. They do an hour, it's just automatic. I gave birth to Ollie, and they put him on my chest and stimulated his breathing and things like that while he was on my chest. I got skin-to-skin time for the first hour, and they didn't even touch him, and that was awesome.
What was the biggest challenge to overcome? The biggest challenge to overcome, we never vlogged with Serenity and Serenity's birth. So the only thing I had was at the last minute I took my cell phone out right once they put Serenity on Heather's chest, and I don't know what caused me to do that in that moment, but I did, and that's about the only video we have of Serenity's birth, other than some photos that a professional came in and did for Serenity's birth. The biggest thing that I overcame with Oliver was the cleft lip. I had to take the day or so to process that he did have a cleft lip. We didn't know that that was coming. It didn't show in any of the ultrasounds or anything like that. So it was something for me to overcome. So when you watch like the first video or so, you don't see any of that in the first video. It's not until the second video that we actually start explaining the cleft lip, and we already got an appointment to go get it checked out and everything, and within the first 6 months to the first year, they go ahead and do surgery on that, so that's pretty cool. I didn't even know what a cleft lip was when he was born. It was all, at that point, it was all new to me.
Am I breastfeeding or am I formula feeding? Okay, this is a big one for people, guys, because there is such a stigma around breastfeeding these days. And there's a separate stigma that often gets overshadowed by breastfeeding, but there's a separate stigma around formula feeding. So breastfeeding is, you know, I think that's considered almost the norm nowadays. A lot of people are like, oh, you're just going to breastfeed your child. And for the most part, you hear, yes, I'm breastfeeding my child. A lot of people and doctors and professionals will say they love it when you breastfeed their babies. You know, they like breastfed babies because a lot of people say it's healthier for the baby, or it passes along viral antibodies and things like that for the baby. And that's all true. I'm not knocking breastfeeding. I mean, but there's this stigma because we're formula feeding. And whenever I tell the doctors that we're formula feeding, they always do a double take and they say, oh, you're formula feeding. Well, you know, we encourage breastfed babies over formula fed babies. You know, breastfeeding is healthiest for the baby. You know that breastfeeding is safest for baby. And breastfeeding encourages that bond between baby and mother. And I'm like, I don't disagree with you on any point. However, there are some moms that can't breastfeed for whatever reason. There are some instances like ours where breastfeeding just isn't gonna work. I mean, I'm home during the summer, but I will ultimately, he'll be 2 months old and I'll have to go back to teaching full time. And when he's 2 months old, I wouldn't want to start breastfeeding him over the summer and only do it for 2 months and then have him switch back to formula feeding, because that's what would happen. There are very few workplaces that actually accommodate breastfeeding moms. Okay, it's one of the things in our society that really needs to get fixed. Because, you know, the only place, I mean, I have to hold my pee for hours on end already before I can go to the bathroom because there's nobody covering my class. So imagine if I had to pump on a regular schedule, there's nobody to cover my class. What am I going to do, pump in the classroom? It just doesn't work. There's no, even if I could get out of the classroom, there's no place to pump other than like the teacher's bathrooms, which I would be sitting on the bathroom floor pumping. And then I would have to store all of the breast milk and either get a mini fridge for my own room, which costs my own money, or go store it in the staff refrigerator in the lounge, which you don't particularly want to do. That would be rather awkward. And so it's a matter of convenience for a lot of parents. And formula, when you look at formula, in today's world, today's technology, and medicine, formula-fed babies are just as healthy as breastfed babies. But there's a lot of stigma around this dichotomy of are you breastfeeding or are you formula feeding? And a lot of times, breastfeeding advocates will just knock formula feeding moms, okay? Like I said, if I could, I would. Breastfeeding is like 10,000% cheaper than formula feeding. I know it. I've done the math. And it encourages mother-baby bonding. No, I have no arguments with anything that breastfeeding, with any of the points that breastfeeding proponents spew to formula feeding mothers. But they forget the fact that for some families, it's just a little bit easier to go whip up a bottle from some powder and some water rather than worry about, hey, I've got to get a baby's got to latch onto my boob right now, or I've got to, you know, go pump my boobs, and it's just easier this way. So we're formula feeding. Ollie is healthy. He's already gained back 1 ounce from the time he left the hospital, and that was, you know, last week. That was over a week ago. We're going back to the doctor tomorrow, so I mean, I'm anticipating he'll be back up to his birth weight. How is Serenity dealing with a new baby in the house? Well, when we came home, if you watched our part 2 vlog, the going home video, I think she was a little shell-shocked at first, and she didn't quite know how to handle it. She just immediately went to his feeties and said, "Oh, little tiny baby feeties." But that was about it. We set Ollie on her lap, and she kind of wanted to hold him, but she kind of didn't know how to do it. She really likes holding the bottle. She worked up to holding the bottle now, and she really wants to help with feedings and things like that. She likes watching when he gets diaper changed. She thinks it's fascinating watching him get dressed, and especially giving him a bath. She'll just sit there on the edge, and if I need something, she's a very good helper. So she's really become kind of like the big helper in this scenario. Right now, she's getting some much needed one-on-one attention time with Nana and Papa, and she's camping for the week with them. But we'll see what happens when she comes back. I think when she comes back is going to be the big adjustment, you know. And also when Ollie's in our room right now in a bassinet, but once he starts sleeping more through the night, once we're not up with him so much, he's gonna end up sharing a room. His crib will be in Serenity's room in the nursery. And so we'll see what happens there. Overall, I think Serenity's doing okay. But, you know, changes still to come.
Is there a major shift in parenting once you have 2 or more children?
For me, because just because you have a baby that requires your full attention does not mean that the toddler doesn't require your full attention either. So really, your full attention is required now for 2 tiny human beings rather than just 1 tiny human being. That's a lot to ask. That's a lot to ask.
I would say no.
I mean, no, it's fine.
But I mean,
it's fine. Think what you want.
But there's 2 perspectives here, because right now Serenity's in a stage where she's all about mommy, 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 mommy. So my role is to try to shift that focus away from mommy, mommy, mommy.
And do a little more daddy, daddy, daddy time.
So that's where we go out and do things with daddy and
things that you can do with a toddler that perhaps you can't do with a newborn. You know, going to the playground and train rides and things like that, and blueberry picking. She loves all of those things, and she can do all of those things.
Are we done now?
Oh, that's the big question that everyone says. You have a girl and you have your boy. Are you done now? And our answer to that is always inevitably check back with us in 6 months to 1 year. We'll let you know.
We got to make a financial decision. We got to make a
parenting decision.
A parenting decision. Is it best?
I have to make a birthing decision.
We'll leave it with this. Is it best for us? And that's what we got to figure out. Is it best for us? So guys, thank you for joining us in today's Q&A video. Thank you for subscribing. Make sure you hit that like button, share this video. And until next time, guys, we'll catch you in our next video.
See you
Bye.
Guys.